Aldosterone. Aldosterone is a crucial hormone that plays a significant role in maintaining the balance of salt and water in our bodies. While the term might sound complex, understanding what aldosterone is and why it's important doesn't require a background in medical sciences. What are aldosterone? Aldosterone is a hormone produced by the adrenal glands, which are small glands located on top of each kidney. Its primary function is to regulate the balance of sodium and potassium in the body. In essence, aldosterone helps control the amount of salt and water retained by the kidneys. This delicate balance is essential for maintaining blood pressure, electrolyte levels, and overall bodily functions. Why aldosterone? Aldosterone plays a vital role in our bodies for several reasons. Blood pressure regulation. One of its primary functions is to control blood pressure by influencing how much salt and water are reabsorbed by the kidneys. When aldosterone levels are too high, it can lead to increased blood pressure, while low levels may result in low blood pressure. Electrolyte balance. Aldosterone also helps maintain the right balance of electrolytes, such as sodium and potassium, in our bloodstream. This is crucial for normal nerve and muscle function. Fluid balance. By regulating salt and water retention, aldosterone ensures that our bodies have enough fluid to function properly without retaining excess fluid, which can lead to conditions like edema, swelling. Common aldosterone tests. There are a few different types of aldosterone tests, but the two most common ones are aldosterone blood test. This test measures the level of aldosterone in your blood. It helps diagnose conditions related to aldosterone production, such as primary aldosteronism, adrenal gland disorders, or high blood pressure. Aldosterone-to-renin ratio, ARR. This test involves measuring both aldosterone and renin levels in your blood and then calculating the ratio between the two. The ARR is useful in diagnosing primary aldosteronism, a condition where the adrenal glands produce too much aldosterone, leading to high blood pressure. Interpreting aldosterone results. Interpreting aldosterone test results requires a healthcare professional, but here's a basic understanding of what the results might indicate. Normal range. If your aldosterone levels fall within the normal range, it typically means that your body is maintaining a healthy balance of salt and water. High aldosterone levels. Elevated aldosterone levels could suggest conditions like primary aldosteronism or Conn's syndrome, which may lead to high blood pressure and low potassium levels. Low aldosterone levels. Low levels of aldosterone might indicate conditions such as Addison's disease, which can lead to low blood pressure, high potassium levels, and overall weakness. How the test is conducted. Getting an aldosterone test is a relatively simple procedure. Blood sample. The most common way to test aldosterone levels is by taking a blood sample. A healthcare professional will clean the area, usually the inside of your elbow, with an antiseptic. They will then insert a small needle to draw a blood sample into a vial. Arrive fasting. In some cases, your doctor might ask you to fast for a few hours before the test. This is because aldosterone levels can vary depending on factors like salt intake and body position. Follow instructions. Always follow any specific instructions your healthcare provider gives you regarding fasting, medications, or other preparations before the test. For whom is this test for and what diseases is it for? The aldosterone test is typically recommended for individuals who are experiencing symptoms or have risk factors for conditions related to aldosterone imbalance. These may include high blood pressure, hypertension. If you have uncontrolled high blood pressure or it doesn't respond well to medication, your doctor may recommend aldosterone testing to rule out conditions like primary aldosteronism. Low blood pressure, hypotension. Individuals with low blood pressure and symptoms like dizziness, fatigue, or fainting may undergo aldosterone testing to determine if adrenal gland issues are the cause. Potassium imbalance. If you have persistent high or low potassium levels in your blood, aldosterone testing can help identify the underlying cause. Suspected adrenal gland disorders. If there are suspicions of adrenal gland disorders, such as adrenal tumors or hyperplasia, aldosterone testing can provide valuable diagnostic information. Family history. If you have a family history of conditions like primary aldosteronism, it may be advisable to undergo periodic aldosterone testing. In conclusion, aldosterone is a hormone that plays a crucial role in maintaining the balance of salt and water in our bodies. Understanding its function, the reasons for testing it, and how the test is conducted is essential for managing various health conditions. If you have concerns about your blood pressure, electrolyte balance, or adrenal gland health, consult with your healthcare provider, who can determine if an aldosterone test is right for you.
Early detection and treatment of aldosterone-related conditions can lead to better health and improved quality of life. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions.